In Brown County, we saw that residents who identified as African American or within the refugee community had the lowest vaccination rates.
When the COVID-19 vaccine became available, our local healthcare systems and our public health departments collaborated together to make sure that the most people had access to the vaccine as possible. And at the same time, there was recognition that those most vulnerable and those most marginalized were not necessarily accessing the vaccine through those pathways. So the CDC RISE grant really is a recognition of some of these gaps and really provides the resources and funding to community-based organizations who we know have established trust, relationships, and communication pathways to make sure that we are focused on the vaccine equity.
The first step through the RISE grant was to connect with our community-based partners to take action.
Our Community Services Agency, or COMSA, is a nonprofit organization primarily established for refugees, by refugees.
We All Rise is a culturally specific agency. It's a resource center in the community that serves African American families and young people.
The next step was understanding the impact COVID had on the communities they serve.
For Black people specifically, we learned that they're more likely to be in homes with other family members, to use public modes of transportation, suffer from underlying conditions such as heart disease. And those were some of the reasons why COVID-19 was disproportionately impacting the community.
And just as important as recognizing the impact of COVID was understanding the perception of the vaccine and why some residents were hesitant or simply not open to the idea.
There were a lot of barriers, a lot of rumors, a lot of hearsays, myths.
So in the Black community, health, it's very scary. Historically, there's so much erasure, so much trauma, and so much pain that's associated with it. And so there are stats that obviously justify the reasons why folks are still very scared of the vaccine.
Wello worked with our healthcare partner Prevea and the resource centers and decided to offer the vaccine on site at the resource centers.
There's all these steps that you see that are necessary when a community has this sort of fear and this sort of truth. It was really, really important for our organization to have an opportunity to say, hey, this hospital is gonna come be here. We're a place that you have for years felt safe, and we've built up trust with another organization that is about health and well-being, and they have listened to and cared for and walked alongside Black folks for the years that we've had these partnerships going previous to that. And so even before the grant, as we all collaborated, Wello, We All Rise, COMSA, we had this commitment to organizations that had built up truth within our community first. There was so many initial conversations that happened to make sure that it was authentic and felt safe. The whole design of the project was by Black people, for Black people.
In the end, it was decided that these events would be more than just vaccination sites, but well-being clinics that, in addition to the vaccine, would provide meals, produce bags, and create a culturally specific setting.
To see everything in one place. So, we have covered the social aspect of it, we had the health and wellness of it, and also the vaccination. And at times we had, those doctors coming in to talk to the community about what kind of other needs they might have. So that was a great benefit for the community.
To be able to have COVID shots on site for our clients, it meant wow, people popping up, first timers, young people, elders that were like, never. Then suddenly it's here and it's at a place that you trust and that feels safe. And you can eat and have laughter and have joy with other people that you trust. And we don't do things like that without really having a commitment and an understanding of what we're doing because our community trusts us to keep them safe.
In total, 8 well-being clinics were held, resulting in 128 first, second, and booster shots given, approximately 2,400 pounds in produce purchased from local producers and provided to nearly 1,300 people, and nearly $7,000 in purchases from Somalian and Black-owned businesses. The ultimate question is, did the clinics, made possible by the RISE grant, create a new pathway resulting in vaccinations?
I would say, had it not the opportunity that we presented to the community, I wouldn't have thought, or this number of individuals would have been vaccinated without these events.
If those clinics don't happen here, do you think those people get vaccinated?
No. In fact, I know they don't. I know they don't.